Cancer diagnoses are down during the pandemic, and that has health experts very concerned. They believe there are just as many cases out there, but they're not being caught early. That may result in more deaths in the coming years. Sarah Avdalov has a story.
Chelsea Edens is in the fight of her life, battling breast cancer during the pandemic.
You know what? I'm not gonna let cancer beat me.
But health experts worry for every case like Chelsea's, many others are going undetected, undiagnosed, or untreated as a result of COVID-19 and will result in thousands of excess deaths.
We are looking at the possibility that for the first time in decades, we don't see cancer mortality decline on a year-by-year basis.
Earlier this summer, head of the National Cancer Institute, Dr. Ned Sharpless, wrote in medical journal Science there could be 10,000 additional deaths from breast and colorectal cancer alone over the next decade. He now believes that estimate is conservative.
That colonoscopy and mammography have declined to an even greater degree than we sort of predicted at the time.
A recent study from the Prevent Cancer Foundation found more than a third of Americans have missed cancer screenings due to COVID-19 fears. Others have delayed the evaluation of symptoms for similar reasons.
In general, we think that cancer is a bigger threat to them than exposure to coronavirus. There are a number of approaches that we can use to make sure that patients can still come in and get the stuff they need without being placed in harm's way.
The National Cancer Institute encouraging patients to communicate with their doctors as it helps treatment centers get back up to speed and pushes for continued clinical trials and research, all critical pieces to combat the enormous impact coronavirus is having on cancer care.
A mother from Texas is opening up about passing COVID-19 onto her newborn baby. The case is one of a few documented around the world of COVID-19 transmission between a pregnant woman and her unborn child. Wendy Figueroa tested positive for COVID right before giving birth. Within 24 hours, baby Alexa tested positive as well. Now, doctors say this might be the first U.S. case of COVID transmission from mother to unborn baby. Dr. Wilmer Moreno says transition from mother to fetus is possible but rare. New testing protocols will help track the trends, but the challenge, according to Dr. Moreno, is treatment.
Typically, women sometimes are excluded from these trials because people are afraid of risk to the baby. So at this moment, all the institutions doing research are very aware that they need to include women and pregnant women in this study.
The CDC says more than 3,000 pregnant women in the country have been hospitalized because of COVID-19. According to doctors, most pregnant women make a full recovery.